Yes, hello everyone. Hello everyone. First of all, I congratulate you upon finishing the last month, and we have started a new month. And an applause to the Almighty for accomplishing, because I know it is not easy. So, on the video of today, first of all, please make sure you subscribe. Make sure you go to our YouTube channel, drkampala, subscribe, follow, and of course get notified every single moment we post videos like this. So in the video of today, let us narrow down and zero down and look into one of the most important things that people have been asking themselves outside there. Like, for example, what are the oral manifestations of HIV? What are the oral manifestations of HIV? You know, of course, HIV has gotten different presentations, and usually most of the common presentation that is known out there when it comes to the oral is lips, which is a side effect sometimes of certain drug. But now in this video, we are going to focus on the different oral manifestations of HIV, and I would request everybody that is on this platform right now, please make sure you continue with us until the end of this video, because what I'm going to mention last is one of the most important things that you should know. Because knowing some of these manifestations is not only important, but it aids in some other different ways. For example, identifying who is the person eligible for going for an HIV test. Because sometimes if you see a person with some of the things I'm going to talk about, or it could be your relative, it could be your sister, it could be a brother, it could be a family member, you could help them by telling them, please, since you're having this presentation, why don't you go and you do an HIV test? Now, straight away, I'm going to give you some of the things, the manifestations of HIV in the oral cavity. So, we are going to start with candidiasis. Candidiasis is caused by Akauka ketuita Candida albicans. This is known as an oral thrush. It is a fungal infection in the mouth, and it is caused by that cauca, which is called Candida albicans. Usually, when the mouth of the person, especially for a person living with HIV, after the immune system is so suppressed, sorry for that. Yes, after the immune system is suppressed, it means the oral cavity inside the mouth, there will be whitish plaques, white stuff. So when the person opens the mouth, it could be on not only on the tongue, but also on the cheeks, the inner cheeks, and the roof of the mouth. And sometimes they appear with some red areas. Usually it is painful and irritating. A person may not be able to swallow. A person may not be able to even take a simple meal, even the drinks, by the way. So for that reason, if you see this, or if you're here on this video and you see this, make sure you visit the nearby hospital for an HIV test. Okay. Then secondly, we have what we call oral hairy leukoplakia. This is caused by an Epstein-Barr virus, and here usually it manifests on the tongue, especially on the sides of the tongue. The sides of the tongue appear with whitish, but of course they look hairy with interruptions, or they may be corrugated, hairy whitish stuff. And here, usually they are not painful. You get my point? They are not painful. They are completely painless. And they are common in people with a suppressed immune system. For example, people living with HIV. And when it comes to those ones that are not on the medication, taking their medication very well, then it becomes worse. So for that reason, if you see one of those things I've talked about already in any of the people, and you are querying the cause, one of the causes should be HIV. Therefore, I would recommend doing an HIV test in such a person. Alright. Thirdly, we have what we call Kaposi sarcoma. This Kaposi sarcoma is a type of a rare cancer that affects blood vessels and the lymphatic system. So, in this case, usually it appears as a lesion on the skin. And it appears purple, reddish brown lesion on the skin, and usually it may be flat or it may be raised depending. It is usually associated with pain, you get, and some mild swelling. So this Kaposi sarcoma usually may affect any other part of the skin, but remember it can also affect you on the mouth. You get? So that is number 3. When you see those 3 things, also make sure doing an HIV test is one of the things. Then another thing, we have what we call Non-Hodgkin's lymphoma. This Non-Hodgkin's lymphoma is also a type of cancer that usually affects the immune system and the lymphatic system. It also affects white blood cells of uncontrollably. They start to multiply uncontrollably. So for that reason, this can affect, by the way, any other part of the body, and the mouth could be one of the part which is inclusive, the oral cavity. So for that reason, in case you see any swelling, especially at the lymph node areas around the mouth, or in the mouth, or in the neck, or anywhere on the body, please also think about doing an HIV test. But usually for it is associated with the other things like fever, night sweats, weight loss, and fatigue. Get my point? So then another, we have gingivitis, necrotizing ulcerative gingivitis. In this case, is a painful gum infection that causes death of the gum tissue. You see, it is a painful infection of the gums. You see the gums that hold the teeth, they can get infected and the gums start to die. Usually it is associated with pain, sores on the gums, bleeding gums, bad breath, and fever. So when you see any person with severe gum infection, the gums, I mean that tissue that holds the teeth, if you see any serious infection of that, please think about doing an HIV test. Are they bleeding? Are they having a bad smell? Have sores on the gum? Infected gum with the wounds and ulcers, and of course death. Sometimes it can even discharge pus. Please think about doing an HIV test, especially for people that are not on medication. So straight away, we are going to look at what we call hyperpigmentation, melanotic hyperpigmentation. This one, melanin, is a pigment responsible for our skin color. And sometimes we could have a pigmentation at any other part of the body, whereby it could be the membranes, the mucosa membranes of the mouth becoming extremely pigmented. So this could also give a clue about doing an HIV test. Thirdly, we could also have HPV infection. HPV is human papilloma virus. It is a common and it is a sexually transmitted, yes, infection. And this human papilloma virus can cause what we call condylomata acuminata, what we call as warts. This appears as a small, it may be flat or raised growth that typically it is common in the genitals, but it could also affect the mouth. So for that reason, you need to be careful in this. When you see anything that is growing inside your mouth, please make sure you contact the nearby health care unit for more treatment and advice. All right. Then we also have what we call Molluscum contagiosum, which is a viral skin infection caused by Molluscum contagiosum virus, and it appears also as a small raised painless lesion, typically flesh-colored pink or white, and it can occur anywhere on the body. And this could be the mouth, you get? It could be the mouth. For it, it spreads, of course, through direct contact with a person. Yes, it could be skin-to-skin contact with a person with it, or contaminated object or surfaces, or sexual contacts. Yes, it can be treated, especially when you go to the right place, as recommended by the Ministry of Health and, yes, Ugandan Ministry of Health and World Health Organization. Then we also have other manifestations. For example, usually in the environment there is contact of a lot of external bacteria with our oral cavity, but luckily enough, sometimes we don't get sick because our immune system is still strong. But for a person living with HIV, especially that one that is not taking the medication very well, this bacterial infection or infections of the mouth could result into serious, not only being serious, but recurrent infection of the mouth. It could affect the tongue, it could affect the teeth, it could affect the gums, it could affect the roof, the inner cheeks, and whatever. So, only that these infections are always recurrent and recurrent and recurrent. All right. Thank you so much for watching the video. Make sure you follow the platform, make sure you follow the YouTube channel so that you can always get updated any single moment we post videos like this. Thank you so much for the video.